Good afternoon, everyone. Thank you for joining us today for the discussion regarding health insurance and Medicare coverage with my guest, Lisa Hullinger from HealthMarkets. I'll give a brief introduction for those who don't know me. I'm Urban Adams. I'm a wealth manager with Dynamic Wealth Advisors based in the Phoenix area. I work with clients throughout the country, however, largely with a concentration there in Arizona and Southern California. And I have been an advisor with Dynamic coming up on 12 years now. And I'm looking to offer these webinars about a variety of different topics, today being healthcare and Medicare. And greatly appreciate you joining us, whether it's the live version today or the recording that you'll see later on. With that, I'll go ahead and introduce my guest. Lisa grew up in Arizona, has two adult daughters, one of which just made Lisa a grandma. Lisa is licensed in Arizona, as well as a number of different Midwestern states and the state of Washington. As we all know, having health insurance protection is important for everyone. As an agent of HealthMarkets, Lisa offers informed choices when it comes to working with her clients to offer health insurance coverage. With that, she works with individuals, families, small businesses, and specializes in the senior market as it relates to health insurance. Lisa will work with clients personally to identify that. In fact, Lisa worked with a family member of a client not long ago who had reached age 26 and was no longer going to be on mom and dad's policy, help them secure their marketplace policy, for instance. Just an example of that. With that in mind, I'll put the presentation up here before. Lisa, did I miss out on anything on the introduction there?
Nope, that should do it, Urban. Thank you very much.
All right, well, we'll get started here. Let me go ahead and put our presentation up on screen. And Lisa, I'll let you you take the lead from here, and I'll keep an eye out for questions along the way.
Got it. So I'm Lisa Hullinger with HealthMarkets. I moved over to HealthMarkets about 4 years ago, but I have been in the Medicare space since 2008. And what I quickly realized with HealthMarkets, it gave me the tools to work with the under 65 individuals. And what I realized is everything that I knew from Medicare really translated well to the under 65 market. And so I'm able to help a lot of people make that transition from being possibly in group insurance or individual coverage, moving into Medicare. And I am in many of the Midwestern states. I'm based in Arizona. I know we've got some folks from California. I am not licensed in California, but I have teammates all across the United States, and some sit right here in the office with me that cover like California, Ohio, some of the states that I don't cover. So let's go ahead and advance, Urban. So the focus is going to be, I'm going to talk about Medicare, but I'm going to talk really about that transition into Medicare. And so key terms, these are things that you probably already know: beneficiary, premium, deductible, copayment, co-insurance. But I think one of the items that's missing here is, especially for our under 65 folks, is also maximum out of pocket. And so the maximum out of pocket is the total amount that somebody is going to spend during the year on their healthcare coverage if they're using a lot of services or their health has taken a bit of a downturn. So just realize that when you're in the working world, a lot of times when you meet that deductible amount, you're kind of done, but not in the individual marketplace non-Medicare plans. That maximum out of pocket becomes a very, very important number when you do not have Medicare or group insurance. So let's advance. Okay, so Medicare typically is for people age 65 and over, but it also can be available for people that are under 65 with certain disabilities or have end-stage renal disease. Next slide. All right, so if you are getting Social Security, then about 3 to 4 months before you turn 65, your Medicare card is just going to end up in your mailbox, typically without you having to take any action. If you are not taking Social Security, then there's going to be some steps that you have to take yourself in order to get enrolled in Medicare. And if you're working, we'll discuss that in a couple slides. But I think one of the most important pieces here is right now, the Medicare age still remains at 65, even though Social Security, you can start collecting your Social Security typically as early as age 62, but more your full retirement age. For many of us, that's in 66, 67 years old for Social Security, but Medicare does remain at age 65 right now. Next slide. So typically what happens is as you're turning 65, there's some decisions to make. Are you going to stay on your group insurance, or are you going to move over into the Medicare space? And many times it does make sense to stay on your group insurance. But if you are retired, taking Social Security, and your Medicare card just ends up in the mail, then it's going to show that your Medicare Part A and B starts the month that you turn 65. And so you are in what is called the initial enrollment period. And so you can pick a plan, but that plan is not going to start until the effective date of your Medicare Part A and Part B on your Medicare card. Go ahead and move on to the next slide. All right, so Part A. Part A, even if you don't take any action, typically Part A starts the month that you turn 65. And so if you are working, even though you don't take any actions, it really is kind of there in the background. And your Part A, in most cases, is tied to the month that you turn 65. Just a heads up for those that are continuing to work beyond the age of 65, you will want to stop making contributions to your HSA pretty much the month that you turn 65. So because your Part A really does, even though it's there in the background and you're not using it, you could incur a penalty if you are still making HSA contributions after the age of 65. Next slide.
Lisa, if I may, while we're on this slide, so the first bullet point there mentions that it's free for most people.
It is.
In what cases might that not be free, or is it tied to income, in other words?
It is if you or your spouse has worked 40 quarters in your lifetime, then you have accumulated those quarters necessary for Medicare. Does that make sense?
It does.
Okay, yeah, and it's fairly expensive for those that actually have to pay for it. But what I see is typically it's not that somebody doesn't qualify, it is they're at a very, very low income and also may not qualify. So then the Medicare Part A is free to those people that are at a very low income. And when I say a low income, I mean under $1,000 a month.
Understood. Now, if I may, and I don't want to turn this into a Social Security webinar, that'll be an idea for another time, of course. But I think for those who are familiar with accessing their Social Security benefit information online through ssa.gov, you can see your eligibility for Medicare as well as your estimated benefit for Social Security. So you may see the second bullet point here mentions work history, and you mentioned the 40 quarters, for instance. It will mention the eligibility for Medicare through that site.
Exactly. Yeah. But typically, if you've been working for a lot of years, like many of us, then you've definitely put in enough quarters to be eligible for Medicare Part A and Part B.
Very
All
good.
right, next page. All right, so um, many people these days seem to be working past the age of 65. And so there's a bit of confusion about, do they put their Medicare in place? Do they not put their Medicare in place? Because they don't, nobody wants to get a penalty. So if you do not have an employer group health plan from active employment, then you want to put your Part B, as in boy, in place. And you do that about 3 to 4 months before you turn 65. And you do that by going on to socialsecurity.gov, and you'll be enrolling in the question is, are you enrolling in Part A and B? A is kind of automatic if you have those quarters. So you're really enrolling in your Part B, as in boy. But if you are still working and you have group coverage, you can delay that Part B until you are ready to retire. So it's worth having a conversation with somebody to see whether your plan through an employer, if Medicare might be a better choice. In most cases, that group coverage tends to be, especially if you're with a large employer, that group coverage tends to be the better choice while you are still working. Because once you put your Medicare in place, then you are going to be paying for the Part B, and I'll discuss that here in a second. But also, lost my train of thought on that one. So you put your Part B in place, and if you have group coverage and you don't really need the Medicare coverage because you have the employer coverage, you're paying for Medicare when you really don't need it, that Part B coverage. So if you have a strong group plan, in most cases, you're going to stick with that group plan until you're actually ready to retire from your employer. Now, if you happen to work for somebody that is under 20 employees, yes, you absolutely want to go to Medicare, because Medicare is going to be your best option. So we've got a question here. If you're self-employed, so if you're not paying into a group plan, then as you turn 65, you will want to go onto Medicare. And if you're self-employed and you're paying for some type of private plan, you're definitely going to want to look at Medicare. And in most cases, Medicare is going to make the most sense for you.
Thank you to whomever asked that question, because
Yeah.
I plan to ask that for us as well.
It popped right up there in front of me. So Part B is tied to your income. And so the Part B is calculated by Social Security using your prior year taxes. And so it's always rolling 2 years behind you to calculate what your Part B premium it will be. So in 2024, the Part B premium is $174.90. That's the standard rate, unless you are making more than. So if your adjusted gross income is above $129,000 for a single person, and this is based on your tax return, or $258,000 for a couple. If you hit those thresholds, then you're going to be paying what's called an IRMA, and that is a income related modified adjusted amount. And so they're on the Social Security or Medicare website, there is an explanation of that IRMA. So there's I believe 5 different categories or bumps up depending on income. But if your income is below that threshold, then you're paying the standard rate that everybody else is paying. And in 2024, that is $174.90.
Lisa, if I may, that then comes into play with individuals working with their advisor to make sure that their income stays at a level that does not invoke, in essence, that IRMA, correct?
That's right. So really, you want to be working with somebody 2 to 3 years in advance because of that prior year taxes, so that you can make any adjustments necessary. Because if you can keep it in a certain, at the standard amount or at that lowest bracket, then you're going to be in a lot better shape than a surprise. But what happens to a lot of people is, maybe you sell a house and you've got capital gains. Well, that's a one-time hit to your tax return, and there is a way to appeal that with Social Security. So Social Security, they will look at things like that, but a lot of times it is, well, that's what your income was for that year, and it's going to stay with you for the balance of that year. And so every year this is reevaluated, looking at prior year tax returns. And Social Security is doing all of this in behind the scenes. They're not requesting any information from you. They are just calculating, and then you get a letter that says this is what you're going to be paying this year.
It's interesting you mentioned that, because I had a client impacted by that when they sold a rental property
Okay.
a number of years, and realized a sizable gain from that, and it had that impact on their premiums initially.
Yeah.
So
Yeah, I saw that with a family member too, where they had a one year where their income spiked. If they did file an appeal, they did not get the appeal. But anytime that, especially those one-time event things occur, it is worth appealing with Social Security.
and then even if the appeal were not granted, then that still would eventually go away with that rolling 2-year period
That
expire.
is correct. Yeah, that is correct. So let's see. So while we're here, so let's talk a moment about active employment. So if you are under 65 and you are thinking about retiring, um, when you retire from a company, if the company has more than 20 employees, you're going to be offered COBRA. And so that is continued group coverage. The difference is you get to pay 100% of the cost of the insurance plus an admin fee. So it's not unusual to see that at about $1,000 a month per person. So that can get a little bit pricey, especially if you don't use a lot of services. And so there's a couple ways that you can go when you're leaving group coverage. You can continue with that COBRA, which is typically 18 months, or when you hit Medicare. Um, but you also have the ability to take a look at outside of that group, outside of the COBRA. So I'm just going to use an example of a couple that I worked with recently. So they were an older couple that adopted a younger daughter. And so she's 21. They are going on to Medicare. To keep her on group COBRA, the COBRA extended coverage, it was going to be $1,100 a month for a 21-year-old. To me, that's outrageous for that amount of money for the coverage. So she's got a couple alternatives. We can look at short-term coverage and or the Affordable Care Act plans. And so short-term plans, they vary in length depending on the state. I'm in Arizona, so Arizona currently we can offer up to 36 months. That is not the case in all states. Some states are even 3 to 6 months, and there is some legislation that we're waiting on right now that could change that to a maximum of 3 months for short-term coverage. But the key with short-term coverage is you want to be healthy, because typically it does not cover pre-existing conditions. Then the other alternative would be the Affordable Care Act plans. And so those are the marketplace plans. And they are those plans, it depends on where you live, what county, what state, what county, depends on the offerings. But the price for those plans is based on your projected income for the current year. And so based on your income, that is going to tell us what amount of tax credits somebody will qualify for, that, you know, the person, the family will qualify for. And then those tax credits are applied immediately to the premium to help lower the cost. And again, this is a great time to work with your advisor 2 to 3 years before retirement to try to plan these things out. Because if you have the ability to keep your income down as you're retiring, and you have to go to the Affordable Care Act plans, having a lower income is going to give more tax credits.
While
Okay, and I'm going to just add one more thing, Urban. And then with the Affordable Care Act plans, there are no medical questions, which means that everybody, no health conditions will keep somebody from being able to be eligible for a Affordable Care Act marketplace plan.
Thank you. And before we left this slide, you'd mentioned it a couple different times, and I'm not sure if I picked up on it or not. And it mentions this very last bullet point, the no penalty if you enroll. What is that penalty, or what is the magnitude of that penalty for someone who does not and they should be enrolled?
It's not that it's such a high dollar amount, it's lifetime. So when Social Security gives a penalty for late enrollment, so it's a late enrollment penalty, that penalty is just not for, you know, 3 months, 6 months, it's for the rest of your life. And so those are the reasons that you want to act in a timely manner, making that transition over to Medicare, because those penalties do stay with you forever.
Very good. Thank you. Thank you for
Yep.
clarifying that.
Absolutely. And I think we've got 1 or 2 more slides, and then we can answer some questions here. Okay, so this is the Part B. So then going back to that Part B premium, you know, you may be subject to IRMA, that income related adjustment. Occasionally I'll see somebody that decides that they don't want to pay the Part B. You know, they just want to have original Medicare and no Part B. Well, Part A of Medicare is hospitalization. Part B is providers. So that is your doctors and lab work and x-rays and everything done outside of the hospital setting. And if you don't have an active A and a Part A and B, you cannot choose a Medicare plan. So again, there's reasons to put it in place at the right time, so that you put your A and your B together as you're retiring, whether that's at age 65 or leaving in group coverage at some point in the future. So you'll want to have an active A and B, because then that gives you Medicare plan options. Without the B in place, then you're limited to only having a Part D drug plan. That may be the last slide, Urban. Can you take a peek at that? Oh, nope, this is the last one. Okay, so you have to have that Part B in place in order to choose a Medicare supplement plan or a Medicare Advantage plan. If you are eligible for TRICARE for Life through military service, then you do have to have your Part B in place. And then also with some state retire, I'll just use Arizona state retirement as an example. With retiree benefits, you also have, once you are of Medicare age, you have to put your Medicare Part B if you want to choose that large group Medicare benefit that's available through like a state or a large group employer. So VA does not require somebody to put their Part B in place, but the VA has changed their opinion on that in the last few years, and now they encourage veterans to put their Part B in place. when they are eligible to do so, because what was happening, they were delaying it. And then when they felt like they needed to put it in place because they needed it for some service, then they had such a large late enrollment penalty, many times they couldn't afford to do it. So earlier is better when it comes to veterans. All right, what questions do we have?
I'm going to go back a slide if you don't mind while we
Yep, go right ahead.
questions. And I see that in the top half of the page it mentions your monthly premium, and I do see a question coming in, so we'll get this one out of the way, and we'll move on to the next question.
Okay.
And I see it's usually deducted from Social Security or it says RRB benefits. Is that railroad?
That's railroad benefits. So if you are taking Social Security, you don't have a choice. The monthly premium comes straight out of your Social Security check. If you're not taking Social Security, then you receive a quarterly statement from Social Security, because Social Security is the gatekeeper for Medicare. There are no Medicare offices. There's Social Security offices, and so you do everything initially through Social Security. Once you have a Medicare ID number, then you can contact Medicare with questions. But until that point, everything is done through Social Security.
Okay. And then let's say that example, that person who turns 65 enrolls for Medicare is getting that quarterly statement, paying the premium, and then they file for benefits at 67.
Mhm.
Upon their receipt of the Social Security benefits, would that automatically switch, or is that something
Yeah,
that others need to do?
yeah, you get a letter from Social Security stating we're now taking the money out of your Social Security check. That is correct. Yeah, once those benefits start, you don't have a choice. It comes straight out of Social Security.
Very good. I do see that we have at least one more.
All right.
Does Medicare Plan G include Part B?
It does. Yeah. So original Medicare is you've got your red, white, and blue Medicare card A and B. And so Plan G is a Medicare supplement. And so it does exactly what the word says. It supplements Medicare. So what Medicare covers, the supplement also covers any portion of that that is not picked up by Medicare. So what happens is going to the doctor, labs, x-rays, that is the Part B portion. There's a $240 deductible this year in 2024. So you are responsible for the first $240. After that, Medicare turns into an 80-20 plan with Medicare paying 80%. And if you have a Medicare supplement Plan G, then it is picking up that 20%. So a Medicare supplement is exactly that. It supplements Medicare. It lets you go to any provider in the United States that accepts Medicare.
And
All right.
and that and I presume there's a separate premium for the supplement insurance. How does or what's the method for one choosing that supplement insurance?
Yeah, so Medicare supplements, there's hundreds of different companies out there that offer Medicare supplements. So you choose a plan that is based in your state of residency, and then that's going to determine the rates for that plan. But the basics of Medicare, like that $240 deductible, that doesn't change because that's set by Medicare. But the rates are definitely set in your state. And then a Plan G is exactly the same with every company, but the company may offer some extra benefits to that Plan G that Medicare isn't covering, but that is offered through the insurance company. And the state makes a big difference on kind of what those extra benefits might be. But those are things like dental, vision, hearing, discounts, not plans, but discounts, maybe a gym membership, 24-hour nurse line. Those tend to be the most typical extra benefits with a Plan G that Medicare isn't covering, but the company that's offering it is covering it.
Very good. Could we, I don't see any new questions in there right now. Could we maybe talk a little bit about the prescription plans? Because I, based on experience with my own clients, not all prescription plans are the same. And depending on medications that clients have prescribed to them, there may be some that are, and not as a group, but more individual to them. There might be better based on the coverage of the medications they're taking.
Okay, so Part D drug plans can be individual or they can be part of a Medicare Advantage plan. So today I'm not going to dig deep into that, but what I can tell you is with the drug portion, it is something that, these are Part D plans and Medicare Advantage plans are 1 year contracts with Medicare. That means those plans change a little bit every year, but then also your medications can change. So it is worth working with an agent like myself to dig in and find the best plan for the drugs that you're using, because sometimes you may not be using the right pharmacy. I mean, sometimes it's an easy thing like that. Other times it is you're on very expensive drugs and you need to understand the phases of the drug plans, because Medicare sets out the 4 stages of a drug plan. And so the low cost generics, you're just not going to feel all of those phases. But when somebody's on more expensive drugs, they're going to feel each part of those drug stages. And so it's a much bigger conversation, and it is definitely more individualized for somebody to understand it well. I mean, I could throw out some really basic stuff here, but that doesn't help each individual person to understand what the cost of their drugs are. So it really benefits. Medicare.gov is a great resource, but then also working with an agent who knows the business, knows the plans, is really the most beneficial way to discover, best price for cost of medications.
Thank you. And maybe that's an entirely different presentation.
It is.
Like,
Yeah, we could do a presentation just on Part D.
very good.
Yes.
Are we at the, did you say that we're at the last slide for today?
Yeah,
Okay,
that is the last slide for today.
excellent. So I will I will open it up to the group again if there are any additional questions. I don't think I have any additional ones. Perhaps, because thinking about, I've got a number of different self-employed clients, and I think maybe this was a question I may have posed a little bit earlier, but let's say that self-employed client has been on a marketplace plan
Mhm.
and they're now 65. Is it better for them to enroll in Medicare at that point? They're going to continue to work, be self-employed and
Mhm.
generate that income, but probably better to switch over to a Medicare plan upon reaching that age.
Yeah, that typically is the best option for most people. Yeah, to make that transition. And some insurance will just simply stop at age 65. Others will let you continue on. Again, that's more of a state decision. But Medicare, when Medicare is available for self-employed people, most of the time it makes sense that they go with the Medicare options.
Okay. Anything that we didn't ask that you'd want to, or maybe hoped someone or I would have asked in the group thus far?
I think we've got it. I appreciate your attention, everybody. Thank you so much for being with us. Any last questions before Urban wraps it up?
Right. Well, Lisa, how would someone who wants to learn more and would like to contact you, what would be the best way for them to reach you?
Okay, so I'm in Arizona, and my direct line is 480-390-4543. I'm I'm putting it in the chat box right now.
Perfect. Thank you. And I'm sure you'll include your email address as well.
I can do that, yes. Oh, I forgot to, I meant to just advance to the next line. All right. So there is my contact information, phone number, and email address. And happy to answer any specific questions that you have. And if I don't happen to, oh, I spelled my name wrong. If I don't happen to cover your state, then I can definitely connect you with one of my associates that does cover your state. And I'll make sure that you're working with somebody that's experienced and knows the market well.
Very good. Thank you again for your time today. Thanks to those who joined us live and those who will later on see or hear the recording. I'm going to go ahead and stop the recording now.